Welcome back. In Lesson 1, you learned how prefixes and roots build medical words. Today, we finish the picture. Suffixes, the endings that tell you what's actually happening to that body part. A process, a procedure, a condition. Let's get into it. Processes. Itis is one of the highest yield suffixes in the entire exam. It means inflammation. Colitis, gastroenteritis, arthritis, all inflammation, just in different locations. If you remember one suffix from this lesson, make it this one. Plasia means growth or formation. Plasm means formative material or substance. Cytoplasm, the substance that fills a cell. Oma means tumor, sarcoma, carcinoma, melanoma. When you see oma, think abnormal growth, often malignant. Trophy also means growth, but specifically growth in the size of existing cells, not in the number of cells. Hold on to that distinction, it comes back in a moment. Pathy means disease. Neuropathy, disease of the nerves. Cardiomyopathy, disease of the heart muscle. Osis means a condition, usually an abnormal one. Ia, as in the ending you see on words like anemia, works the same way, an abnormal condition. Ism means a state of. Hypothyroidism, the state of having a low, underactive thyroid. Ik or eel means pertaining to or related to. Cephalic, pertaining to the head. Esophageal, pertaining to the esophagus. Exam tip for OET reading and writing. Examiners frequently swap trophy and plasia in distractor answers precisely because they sound similar. Hypertrophy is growth in cell size. Plasia is growth in cell number. Different mechanism, different word, and the exam expects you to know the difference. More processes. Meta is a prefix meaning change or transformation. Metaplasia, a transformation from one cell type into another. Stasis or static means maintaining normal, stable conditions. You already know this one from homeostasis. Homeo, similar or same. Stasis, standing still, maintenance. Keeping your body's internal conditions steady and unchanging. The opposite of stasis is dynamic, continual change. Hemodynamics, the continually changing forces of blood flow. Lytic or lysis means destruction or breakdown. Hemolysis, destruction of red blood cells. Megaly means enlarged. You met this as part of hepatosplenomegaly in Lesson 1. Here, it's the same idea, used as a standalone suffix. Penia means decreased, low, or below normal. Cytopenia, a decreased number of cells. Anemia relates to a blood condition. Anemia, a blood condition involving low red cell count or hemoglobin. Pain, discharge, and function. This next set covers how a patient experiences a condition. Pain, fluid, movement, function. These come up constantly in OET speaking role plays because they're exactly the words patients use to describe symptoms. Algia means pain. Cephalgia, headache, literally head pain. Myalgia, muscle pain. Neuralgia, nerve pain. Any body part plus algia and you've built a symptom word. Rhea, spelled with a double R, means flow or discharge. Diarrhea, an abnormal flow from the bowel. Rhinorrhea, a runny nose, literally nose flow. Amenorrhea, the absence of menstrual flow. The A prefix here means without, so amenorrhea is without menstrual flow. Close to it, but not the same word, is aregia, which means excessive or abnormal bleeding. Menorrhagia, abnormally heavy menstrual bleeding. Don't confuse rhea, ordinary flow, with aregia, excessive bleeding. Examiners like testing this pair precisely because they look and sound so similar. Phagia means eating or swallowing. Dysphagia, difficult swallowing. You'll hear this on nearly every stroke ward since swallowing difficulty is a major post-stroke complication clinicians assess for immediately. Phagia means speech. Aphasia, the loss of speech, usually from brain injury or stroke. Dysphagia, difficulty with speech. Note the pattern. Dys attaches to almost any function suffix to mean difficulty with that function. Dysphagia, dysphagia, dyspnea. Once you know dis, you can build all three. Seal means a hernia, swelling, or protrusion. Hydrocele, a fluid-filled swelling, most often around the testicle. Ptosis means drooping or prolapse. In everyday use, you'll meet it as blepharoptosis, drooping of the eyelid, often just shortened to ptosis in a clinical note. Sclerosis means hardening. Atherosclerosis, the hardening and narrowing of arteries caused by plaque buildup, one of the most frequently tested terms in cardiovascular OET material. Stenosis means narrowing. Aortic stenosis, narrowing of the aortic valve, restricting blood flow out of the heart. Asthenia means weakness. Myasthenia, muscle weakness, as in myasthenia gravis, an autoimmune condition affecting the muscles. Medical procedures. Now the suffixes that describe what a clinician actually does. Ectomy means excision or surgical removal. Appendectomy, removal of the appendix. Otomy means incision, cutting into. Tracheotomy, cutting into the trachea. Ostomy means creating an opening, typically for a new connection. A colostomy creates an opening from the colon to the surface of the abdomen. Note the difference. Otomy cuts. Ostomy creates an opening. In OET speaking role plays, mixing these two up mid-consultation is a very avoidable error. Scopy means to view, to examine visually. Microscopy, viewing under a microscope. Graph or graphy means the process of recording. Sonography, the process of recording using sound. Gram means the record itself, the output. Mammogram, the recorded image of the mammary gland. Plasty means surgical repair. Angioplasty, surgical repair of a blood vessel. Therapy means treatment, straightforward and everywhere. Chemotherapy, physiotherapy, radiotherapy. Centesis means a surgical puncture, usually to remove fluid. Amniocentesis, puncturing the amniotic sac to sample fluid. Thoracocentesis, puncturing the chest cavity to drain fluid around the lungs. Desis means surgical fixation or binding. Arthrodesis, the surgical fusion of a joint, fixing the bones so they no longer move against each other. Pexy means surgical fixation, putting an organ back in place and securing it. Nephropexy, surgically fixing a kidney in position. Tripsy means crushing. Lithotripsy, crushing a stone, most commonly a kidney stone, using shock waves. Raphy means suturing, stitching something back together. Herniorrhaphy, surgical repair of a hernia by suturing. A few prefixes travel with these constantly. Chemo means chemical, chemotherapy, chemical treatment. Echo or sono means sound, echocardiogram, using sound waves to produce a recorded image of the heart. Electro means pertaining to electrical activity. Electrocardiogram, an ECG, records the electrical activity moving through the heart.
That's every suffix you need. Next lesson, we put it all into practice. See you there. Follow for more Medical English Pro.